this video, I want to talk about decompressing the spine or relaxing the muscles of that low back after, before, around a golf. Okay, so what are some things that we can talk about or positions that we need to know in order to effectively, what we might call decompress the low back and the mid back after around a golf? What are some concepts or key thoughts that we need to understand about creating intra-abdominal pressure for stability around this low back? And then what are some positions and drills where we can encourage some opening and traction into the low back? That's what we'll walk through today. Intra-abdominal pressure, some simple decompression drills, and then loading or moving the spine through a deloaded, or what we might consider like a decompressed position. So the first exercise or movement that I want to show you has to deal with working on what we call intra-abdominal pressure, or the strategy of creating pressure and stability here in that low back and core, what we might call like the right way, the way that's not going to add more compression into that lumbar spine and low back. Okay, so with this next drill, as we walk through intra-abdominal pressure, remember it's all about using the diaphragm and the muscles of respiration to pull down, take away space, which effectively creates pressure 360 degrees here around the abdomen. This is how we can, again, take the load off these lumbar, paraspinal muscles and the other muscles of the low back, which are clenching and turning on to create stability, which are at the same time creating compression. So how can we decompress the spine if we're not first learning a different stability pattern that's not going to compress, but instead create expansion, stabilize through expansion? So that is going to be the role of intra-abdominal pressure. Check out this next drill to learn a little bit more about how we use the breath, and then a simple way to go about challenging your ability to create intra-abdominal pressure and get better at it while we move the extremities around it and staying stable here at the core. Okay, this is our DNS 3-month supine position. What the position looks like is we'll have our knees up at about over top of our hips, and then our feet are slightly above the plane of our knees. All right, now to get there, we can practice here. What we're trying to do here is create intra-abdominal pressure. So we do that by inhaling, big breath in through the nose, and then we can exhale through our nose or through our mouth. Now the key is when we inhale is if we put some pressure into the front of our abdomen here, your inhale through the nose slowly should be able to push your fingers kind of up and out of that space. Okay, once we get good at that and we can push our fingers out of the front of our abdomen, we move on to the side of the abdomen, and here we try to do that same exact thing. So big inhale, but slow. Don't try to get a big, fast inhale. We want it to be a slow, pressurized inhale. So if you can get consistent pressure into those hands, you're doing a great job. We're able to push the fingers and some pressure into the side of our abs. Now what we want to do is work into that low back / side as well. So we want to be able to pressurize through here. Go right next to that big thick muscle on your low back, come just out to the side of it, put some thumb pressure in there, and then try to push your thumbs out again with your breath. So we should feel some pressure starting to push our hands out. If you can do all 3 spots, then you're doing a really good job of creating pressure in 360 degrees around the abdomen. This is how we want to pressurize through the core to create stability through big movements. Now, to take this up a notch is we can kind of challenge it by getting into this position again. Try to pressurize 360 degrees like we just learned. If you struggle at any one of the 3 spots, spend some time there just learning what does it feel like, what do we have to do to pull pressure into that spot, right, and get breath and intra-abdominal pressure there. Then we come up into this position and we just breathe through here. Now we want to be able to maintain a relatively flat low back as we do this, but we don't want it to be a big contraction here to pull everything down. We want to be able to start there, breathe, create intra-abdominal pressure, and just use that pressure to stay there. The next step is we can start to challenge things by reaching one extremity, continuing to create that good pressure 360 degrees, and then we can reach the arms as well, and we get both going at the same time. This is trying to pull us into extension here and an anterior tilt. But if we create good pressure here throughout the start of it and are able to maintain that pressure even through the exhale and still keep the diaphragm involved, then we create enough pressure through here that we can move our limbs like this and not lose that position. So that is the key goal here, is trying to create intra-abdominal pressure throughout the respiratory cycle, and we can move and challenge our limbs on top of it. Go ahead, give it a shot. Okay, now these next few drills can be difficult to get right. They rely a lot on positioning and cueing and feel, internal feel. It's very hard someone to watch you do it and see if you're doing it right or getting the right feel from it. But follow through the movements and one step at a time and see if you can get the right positions and get the right feels that will help to internally decompress through that low back and that mid back. If you feel like one does a better job than another, than the other two, then stick to that one and do that one more often. But here's a simple way without any equipment or help for you to decompress through that low back. For use that word decompress, it takes some pressure off of it. Well, again, without any equipment needed, it's just you and the muscles of your abdomen and core. Okay, for this movement here, we're looking to pull traction into the low back and even just in the spine in general. A few of our goals here are to create or recreate or help recreate the curves, the normal, the natural curves of the spine by using positioning and breathing, right? What we can do is focus on trying to create length or traction from the bottom of the rib cage to the pelvis. We're trying to create as much space and length through that lumbar spine again. We're trying to let the lordosis curve of that low back come into play again, kind of just exist naturally and normally again. And then even if we can emphasize that curve or lengthen that curve, and we'll kind of take the curve out. Same thing with that T-spine, that mid-back. We're trying to re-emphasize that curve, but also create length through that part of the spine as well as we kind of switch back and forth between those two. So a great way to relieve some tension in the low back with a movement like this. What we're doing here, we're on our hands and knees, and we can get a relatively wide, whatever's kind of a comfortable position that lets you sit back towards your heels. So if it's knees wider or closer, whatever it might be. From here, you're going to sit back. As we do that, I want you to think about pulling your rib cage or your, let's say, a neutral pelvis where your rib cage is stacked directly over your pelvis. So we're not here where the belt buckle is turned down, and we're not super high where the belt buckle is pointed way up. But I want you to be somewhere right in the middle and then try to maintain that position. So instead of letting your low back go into a big curve here, try to make sure that we stay somewhat neutral. And you might feel the core kick on and help make that happen. From here, we're going to reach your hands as far away from you as you can as we kind of maintain this sit back. Now, I don't want you all the way down and resting. I want you just short of that. And what we're essentially trying to do here is think about reaching your hands, and then they're just barely resting on the ground as you reach your pelvis backwards. So these two things, it's almost like they're doing the opposite, or they're trying to get as far away from each other as they can. And you have to stay neutral in that low back. You're not allowed to dump pelvis straight down. So pull that right back up. Now think like the pelvis is kind of the anchor point, and you're reaching your hands away from it, but the pelvis isn't allowed to move with them. From here, we're just going to breathe. So in through the nose, nice and slow, let it take its time. And you're trying to pull that air straight down into your pelvis, almost like you're pulling that air straight down. I want you to, from here, exhale through your mouth. Again, let it take its time. Don't try to be quick. You're going to feel these muscles around the side abs start to work pretty dang hard. You might feel more core kicking on. Maintain that tension as you use those respiratory muscles to push that air out. It's going to start building tension through there. I want you to hold on to that a little bit. Just actively hold on to it as you slowly breathe back in through the nose again. And what's that going to do is it's going to keep your rib cage kind of tucked down in neutral as you breathe back in. So if the rib cage can't compensate and flare, instead, because we're going to be holding it down, is you're going to get all this expansion movement through the spine and that rib cage again. And that's how we start to pull traction through that mid back and low back as we breathe, by holding on to a position like that. So we're not quite resting on our heels, we're just off. We're reaching your hands as kind of as far as it'll let you. I want you to stay as neutral through your head and neck as you can. So think face parallel to the floor, and then just pull that up slightly from there. You're reaching your hands without your pelvis moving forward with them. In through the nose, long exhale through the mouth, and you're just trying to maintain that position. And it's almost like you're trying to stretch between the top of the pelvis and this bottommost rib as you breathe and reach. So go ahead, give that a shot. Okay, for this position here, what we're trying to do is create expansion at the mid back and above, or even creating a little bit of length through the lumbar spine and some traction through that lumbar spine as well. We can use this position to create some neutral positioning at the cervical spine and head too. We can create traction through that part of the spine as well, just depending on where we put our emphasis. What we'll do is start face down, and your head will be resting on the ground when we're focusing mostly on T-spine or that mid-back lengthening, expansion through the muscles, the rib cage. at that mid back and even through that low back. So forehead is going to be resting on the ground here. Arms are at about 45 degrees out from there. So from here, somewhere in the middle. The goal with this is you're trying to reach your head while your belt buckle stays heavy to the ground. It's like you're trying to reach your head as far forward or away from you as you can. And to do that, you'll notice that your chin kind of tucks and you reach the top of your head. I don't want you reaching your chin out as far as you can. Think the top of your head. And then you'll rest that down into the ground as you kind of continue to try to lengthen. And the same thing with the hands and fingers. You're trying to almost like walk your hands out as far as you can. Once you get into this position where you're reaching with your head and your hands, what you're going to do is simply just slow things down and breathe. So slow inhale through the nose and a long exhale through the mouth. Let it take its time. Get as much air out as you can. You'll feel the rib cage start to tuck down. Just use those muscles of respiration to hold that position there. And then slowly, again, as slow as you can, start to breathe back in through the nose as you kind of hold that position. And you'll feel that upper and that mid back start to expand and lengthen. And you'll get a ton of movement through the rib cage and the spine again that you probably haven't felt before just by holding these hands out, just reaching as far as it'll let you, your head as far as you can forward. And we're going to hang out there and breathe. Go ahead, give it a shot. Okay, for this position here, we are working on creating decompression through the spine, the lumbar spine, thoracic spine, maybe even potentially a little bit of the cervical spine, trying to find some neutral positions. What we're going to do here is incorporate a little bit of the posterior pelvis, so some hip, glute, hamstring, and then we're connecting ourselves with the ground as well. So for this position here, we'll have a relatively wide stance, and we're working back into these hinges. So feet are flat. You feel the inside edge of both feet. You feel the pinky toes and the heels, slight bend in the knees, and then think that the hips go straight back as this head reaches as far forward as you can get it. So here comes that tug of war again between the pelvis and the head. You want to get those two things as far away from each other. It's like the pelvis is the anchor point, and you're reaching your head as far forward as you can. Now, as we do this, feel my weight kind of shifts backwards, but my head starts reaching forward. I maintain somewhat of a neutral spine, so I'm not slouched through here as I reach. I want to be able to maintain some of that spine neutral. Soft bend in the knees, hips go back as that head reaches as far forward as you can. And I feel like a little bit of a stretch through the hamstrings, maybe even a little bit into the glute. From here, now we get the hands involved. I want you to reach your hands, and it even helps a little bit to kind of press your fingertips together. So from here, once we get into our hinge, and we get a little bit of stretch, and we're reaching and staying neutral through the spine. So I want you to reach the hands and fingertips and then start to press them into each other as you more reach. And as you press through there, you'll feel this kind of widening and lengthening through some of the lats, the shoulders, that mid back, and even into the hamstring a little bit more in that low back. As we hang out there and we hold that position in that hinge, I just want you again to lock that in, breathe in through the nose, out through the mouth. And the key with this is just to slow those breaths down. So the longest exhale that you can manage, trying to get every last bit of air out without changing your position, and then hold some tension down there as you, again, don't rush it. Take a very slow but long inhale through the nose and just feel this space getting filled up and some expansion starting to happen. And you feel the stretch that you have on the muscles will get even bigger. You'll get kind of more of a stretch, more of a lengthening happening as you slowly inhale, so long as you maintain some of that tension. Okay, so go ahead, give it a shot. Okay, now these last few movements are going to work through spinal flexion. When we get a compressed low back or this tightness and achiness in the low back, a lot of times we're stuck in extension. And so what these last two movements are going to do is encourage that low back and lumbar spine to start going into flexion again, which tends to take some pressure off those segments. Now, we have to be someone who's not too symptomatic to work through these next few positions. Sometimes they can be a little bit irritating depending on where we are in the treatment plan or treatment cycle or pain cycle. So just make sure that they feel okay, go through them slowly, work up in terms of how hard you're working or the resistance that you're using, and just do that over time. So a little warning there, but otherwise, these movements are now going to start to work to bring flexion back into the low back, which tends to be, for most people, stuck so much into extension. Okay, so try these next few movements, give them a shot slowly, and make sure that we're still getting good movement out of them and a good feel, and not just irritating something or making something worse. These are our heavy banded sit back drill. So essentially what we're doing is a sit up and a reverse sit up, but we're doing it in a very certain way. So we have a very heavy band here that we can hold tension into. This will help us control the descent, and then as we come back up as well, we're going to get some core activation, some core work, feel the abs working here, but that's not the primary objective. The primary goal here is to create and maintain as much lumbar flexion, so low back flexion, as we move into extension. So again, the goal here is kind of keep that rounded low back for as long as possible. What I want you to think of in this start position is that you're trying to get L5, the lowermost lumbar or low back vertebrae, to touch the ground without the one above it touching the ground. And then you can move to the one above it and then the one above that. So it's one segment at a time touching the ground. That's the thought. It won't actually happen that way, but if you do your best to try to make that happen, then you're doing a good job. So feet stay flat. All I'm trying to do is keep that rounded low back as I sit back. I'm thinking of one segment at a time. I'm working hard to try to make that happen. And then slowly I kind of uncoil the rest of them as well. And then I can do the same thing on the way back up. I'm trying to get one vertebrae up off the mat at a time. So you're trying to be as rounded into that low back as you can as you come back up. So you can do, there's levels to this. The harder you work to create more flexion into that low back, you'll feel that you actually work the core a little bit harder to make that happen. And you might even flex the glutes and get that low back involved to try to create as much flexion through that. That's what we want to do. We want to create that separation and lumbar flexion and get more comfortable there. Take some pressure off the low back. Okay, so this could be great for a lot of people. Some people, this could be an irritating movement. Just make sure that it feels good for you and it's not making any symptoms that you might have in the low back worse. Otherwise, it's a great movement to try. Go ahead, give it a shot. Okay, this is our reverse Jefferson curl. What we're doing here, we got a relatively thick band, and you can play around with how much thickness you need or want. It's going to be at around knee height, maybe a little bit above, could be even a little bit below. But what we want is standing up tall, you hinge down, push your hands through the band, and keep pushing. At some point, we're going to get enough resistance on this band that you have to actively pull yourselves down to try to get that band lower. What I want you to resist is the temptation to just start pushing your weight forward onto that band, but instead keep full foot contact, hinge back, drive your chest down, allow this low back to curl. And what we're trying to do is get more curl through that low back as you use your core and anterior muscles here to actually actively pull yourselves into this lumbar flexion position. So we can actually drive a little bit of lumbar flexion through load or against load with this reverse Jefferson curl. So go ahead and give it a shot, play around with the resistance, and it should be a slow, controlled pull into that resistance. Control yourself on the way back up. It's always good to go all the way back up. And then again, we repeat for reps from there. Give it a shot. Here is the thought process on how we can, say, decompress the spine, especially when you're getting the symptoms of compression and achiness in that low back before a round of golf. If you're going through a cycle of pain or tightness, that you can do before your rounds of golf and hope and make sure that this, again, creates some relief of symptoms and you can play a little bit better and feel like you can move a little bit better and not quite sore after. Or you can do after the round of golf if you're going through a flare up to help kind of work through some things. Just make sure you're only working us so far into these drills, movements that they feel good and they're not bothering things or making things worse that day or the next day. Okay, so if you liked this video, go ahead and like and subscribe, share if you can, and stick around for more videos similar to this. Thanks. Bye.